Hi everybody, it's me, Lori. Welcome to my presentation today on kidneys. I am so happy you're here, whether you're live or replay. If you are live, please pop down below in the comment section. Let me know that you can hear me and you can see the slides. I really wish I could get rid of the picture in the corner, but it won't let me. I'm a little rusty on PowerPoint. But I'm glad you could come today on a Saturday afternoon. And the reason why I wanted to talk about it today is I am a kidney health coach certified by the American Kidney Fund, and I do some other volunteer work for them. And the reason is I really want to get the word out that it's really simple to check your kidney function and see how you're doing, because the goal here is to help prevent kidney disease at all. But we're going to talk about all that. We're going to talk about what kidneys do. And since February is actually Heart Month, and we're transitioning to March, which is Kidney Month, this is the perfect time to have this talk because the heart and the kidneys are very much related to each other. So a little about me if you don't know who I am. My name is Lori, and I am a 2-time transplant recipient. I had a kidney pancreas transplant about 25 years ago, and a second kidney transplant a little over 5 years ago. And so that experience, along with, I happen to be a nurse. I also was a kidney and pancreas transplant coordinator for 15 years. But having said that part about my being a nurse, just my disclaimer, please do not take anything you hear here as medical advice or construe it as something that applies to you. Always check with your healthcare provider before following any of these recommended strategies to help keep yourself healthy. Okay, so let's start with what kidneys do. There we go. So the kidneys, they are as important as your heart or lungs or liver or any other part of your body. And people don't really realize that. But the kidneys are super important. They are 2 little bean-shaped organs about the size of your fist. And if you were to take your hands and kind of put them behind your back, up against the bottom of your rib cage there, also known as the flank, sometimes you have pain there with a UTI or something like that. That's where your kidneys are. And kidneys vary in size depending on your size, of course, but generally they're about the size of your fist. Also, the kidneys then connect to 2 little tubes that we call the ureters, and those connect to your bladder. And the bladder, of course, fills with urine, and that's how you get rid of excess waste. So, does everyone have 2 kidneys? No. Some people are born with 1 kidney. Some people just have 1 kidney after donating 1, and you can live with 1 kidney for the rest of your life. So what do the kidneys do? I wish I could have those fancy slide-ins where I could make you guess before I put these down. But the first thing that kidneys do, and probably the most important thing kidneys do, is they act as filters. And the kidney is filled with like hundreds of tiny little filters. And the blood goes in, cleans the blood. The clean blood goes to the rest of the body, while the lower, I'll show this in the next slide, but while the rest of the waste and water go down into your bladder. The other thing they do is keep the right amount of nutrients and minerals in your body. By minerals, I mean things like potassium and calcium. What else am I thinking with? And phosphorus. Those are 3 really key things. People who have kidney disease probably know this already. Oh, and by the way, when I ask about your relationship to kidney disease, if you do have kidney disease or you are a dialysis patient, keep in mind I'm giving you general advice from the American Kidney Fund, and it may not pertain to you specifically. Other things the kidney does is control blood pressure, or helps control the blood pressure. And the other thing it does is keep bones healthy, which makes sense when you realize it regulates calcium and phosphorus. And it makes red blood cells. Did anybody know that? So the kidneys do help make red blood cells called erythropoietin. It's a very key function of the kidney as well. Now let's talk about chronic kidney disease and what it does to the kidney itself. So you see down in the little drawing, probably to your left, that there's a healthy kidney where blood goes in, like I mentioned. The filters clean the kidneys of waste and extra water, and that stuff goes down into the ureters into your urine. the rest of your blood, the cleaned blood, then circulates to the rest of your body. So I think you can see why the function of the kidney is, is very important to the rest of your body as well. When a kidney is diseased, like the one on the right, you see that the blood is going in, the kidney is damaged for whatever reason, and not able to filter. So some of that wasted water doesn't get put down into your bladder, it goes into your bloodstream. So there are 4 stages of chronic kidney disease, or CKD. Stages 1 through 3, generally you don't have any symptoms, you feel pretty good. There's mild to moderate damage to the kidney. Stage 4 is severe kidney disease, and some patients still don't really pay attention to symptoms. Others do have them. And then stage 5 is kidney failure, or you are close to kidney failure. And I would say, like they say here, most people don't know they have kidney disease till they reach stage 4, which is too late. So let's talk a little blurb on kidney failure. We'll talk about it later. Kidney failure is also called end-stage renal disease, or ESRD. And when a person has kidney failure, their kidneys are not working enough to keep them alive. So I'll say that again, you have to have your kidneys working to live. If a person has kidney failure, they either need to get on dialysis or get a kidney transplant in order to survive. So this is a sports-themed talk. So in terms of playing to win, this is understanding the causes to empower you to know the causes of kidney disease, so you can be more aware if you have some of these causes, these diseases, to check your kidneys. There we go. Who can get kidney disease? Anybody can get kidney disease. It really doesn't matter who you are, you can get kidney disease. Having said that, though, people with high blood pressure and diabetes are more likely to get kidney disease. We'll deal with this illustration a little bit later. Oh, big slide. So the #1 cause of kidney failure in the United States is diabetes. Whether it's type 1 or type 2 diabetes, they make up 50% of all kidney disease and kidney failure patients. That's a big number. So with diabetes, the problem is that, I have to look a little bit closer to the camera, sorry about that. The body isn't either using the insulin or it's not making its insulin. So a little brief discussion on diabetes is, if your pancreas, which is the little gland down in your belly, if it doesn't make insulin at all, then you're usually considered a type 1 diabetic. And if it does make insulin, but your body isn't metabolizing it or utilizing it, then you tend to be called a type 2 diabetic. So that's kind of how that goes. And when there's too much sugar in the blood, your kidneys have to work pretty hard to try and filter it. And if it can't, over time it will get damaged. So that extra sugar ends up in your bloodstream rather than being metabolized by the body. So that's kind of what those illustrations are. I'm sorry, the bottom kidney doesn't show very well. So over time, the kidney does get damaged by diabetes. On the average, a normal blood sugar would run between, and this is for fasting patients who haven't been eating anything for 8 to 12 hours, your sugar should run between 65 or 70 to 99. And those who have eaten something and had their blood sugar checked, usually between 100 and 140. This is for non-diabetics. If you're diabetic and you've eaten something, your sugar will be a lot higher than 140. Oops, did I skip one? I sure did. Hold on. Oh no, it won't let me go back. Well, that slide was about high blood pressure, and it's to tell you that it is the second leading cause of kidney disease and kidney failure in the United States. Yes, people can have both diabetes and high blood pressure, but when they look at what was the primary cause of kidney disease, that's what these statistics are coming from. So blood pressure, second leading cause at 25%, which tells you how much diabetes and high blood pressure, 75% of kidney disease is caused by those two entities. So high blood pressure makes the blood flow very forcefully through. It makes the heart pump too hard, or to work too hard to pump. It forces that blood into the kidney. The kidney can't always handle all of that. And so, unfortunately, this damages the kidney and causes kidney disease. Oh, healthy blood pressures usually run between 120 over 70 or below. Everyone's a little different on their normal. And then anything over 140 over 90, especially if you've checked it about 3 times and you still find it to be that high, you probably have high blood pressure, otherwise known as hypertension. So another thing about high blood pressure is that kidney disease can also cause high blood pressure. So it's we've as a transplant coordinator, I saw a lot of both, where they had another type of problem causing their kidney disease, but once the kidney got damaged, it couldn't control the blood pressure. And remember, I said one of the functions of a kidney is to help control blood pressure. So sometimes the two go into the same, and sometimes they're completely different, which causes what. So next. Others at risk for kidney disease. My dog is next to me, very, very hungry. Other causes of kidney disease is heart disease. Again, the two are tied so closely together. So heart disease can cause kidney problems. Certain, I have to see which one's next. Oh, okay. So for genetics versus people in my family had kidney problems because they were all diabetic. If that's the case, you are also likely to get kidney disease from diabetes. But there are genetic diseases, very specific ones that do cause kidney failure on their own. The other thing where it's more common for diabetes is in African Americans, Latinos, Native Americans, and Pacific Islanders. And we saw a lot of that where I worked, all of that actually. And in terms of African American, all of them actually, it's a genetic predisposition for various diseases that cause kidney failure or kidney disease. In African Americans, high blood pressure is extremely common. In Latinos, Native Americans, and Pacific Islanders, diabetes is extremely common. And the other group at risk is over 60. Like everything else, as you get older, things wear out, and kidneys do have, they do have a lifetime. So the older you get, you do lose a little kidney function, and that's kind of normal, but usually enough to carry you through until you're a ripe old age. So in terms of our playbook, remember I'm the coach. I didn't wear a hat, but the playbook would be strategies that we use to deal with kidney disease and kidney failure. So there's like these defensive plays and there's offensive plays. And these defensive plays are generally related to healthy lifestyle changes. So number one, and I understand many of you are going to roll your eyes and go get a snack in the middle of this presentation here, but bear with me. Being active is so important. It's important not only for your kidneys, it's important for your heart and lungs and everything else, and frankly, your mental well-being. I mean, I think we all know from this past year of being huddled at home or staying inside, we haven't been able to get out as much as we can or exercise as much as we can with gyms being closed. But little things count. So in setting a goal, I admit that setting the goal to exercise for 30 minutes, 5 days a week is a lofty goal when you don't already exercise. I started working out on a rowing machine and walking a little bit about 6 or 7 months ago, and I'm still not doing it 5 days a week because we get busy, right? So set small little baby steps. Why not just walk around the block, get some fresh air, clear your mind, maybe do that for a few minutes, a couple times a week, and then slowly increase from there. So start small, but get out there. Try dancing to videos on TV, whatever works for you. I go up and down. I have 2 little steps outside my backyard, and I just go up and down those steps to music, and it really does get my heart pumping. I can do it longer, actually, than I can the rowing machine. It's less boring. So try little steps to get yourself in shape. Eat a healthy diet. Now, I know you're really rolling your eyes, but eating a healthy diet, the medical profession has only been saying this for decades, maybe centuries, that eating a healthy diet will make a difference in your overall health. And as a nurse, I've seen that. So in terms of preventing kidney disease, diabetes, and high blood pressure, keep a low salt diet. Limit your use of excess fats and sugar. Try to eat more fruits, veggies, whole grains, and lean meats. And also consider changing your portion sizes a bit. I am so bad about that part. So, by the way, while I talk about this diet, why don't you comment below what your biggest weakness is? Is it eating? Is it exercising? Is it the salt? What's the hardest thing for you to cut back on? I'd love to hear if it's not just me. So in terms of keeping a healthy diet, you want to, low salt, avoid the fatty foods, avoid the heavy red meats often if you can. Try to decrease the amount of that. And think about all the hidden salt. So I think, if I remember right, the RDA, or the American Dietetic Association, they recommend for most healthy adults like 2,500 milligrams of salt a day. That's only a teaspoon. So if you think about all the hidden salt, the chips, the granola bars that say there's not a lot of salt in it, or there's actually a lot of salt in yogurt, I found that out. So the key here is check your nutrition labels. Try not to use the table salt too much. Use good substitutes. I am crazy about cooking with lemon, and so I do use lemon a lot. I use lemon mixed with garlic and other spices to try to season my food without using as much salt. I always use low salt broth, or really it should be unsalted because I have a lot on hand for Kirby, my dog. But try to use low sodium whenever you can. I will say one thing about salt that's not here, and that is, don't try salt substitutes in order to make up for salt. One, it doesn't taste anything like it. Two, it's extremely high in potassium, and that may not be in your best interest, but discuss that with your doctor, okay? Next, in terms of a healthy diet, limit the fats, which means the red meats, the fried stuff. Beans, lentils, legumes. That's actually been a big increase in intake, I've noticed, for a lot of people. And a friend of mine with diabetes said that her doctor put her on an anti-inflammatory diet. I don't know much about it, but I know it includes a lot of beans and legumes, and it is a source of protein. It's just a healthier source rather than fatty foods. So try lean meats like turkey, chicken, egg whites instead of egg yolks if you want to cut out the cholesterol, stuff like that. And instead of butter, use olive oil and vegetable oils. I'm laughing because I use a ton of butter when I cook, especially this last year, which is no wonder my cholesterol went up. I don't use salted butter, I use unsalted, but now I have an air fryer. So for all of you that have an air fryer, you already know the number one thing you use in it is olive oil, either the spray or brushing it on, and it's so much better for you, and you're using a lot less of it to fry your food. So if you crave fried foods, try an air fryer because you usually end up using a lot less fat. And the other thing, of course, is saturated and trans fats. Now, what are those? I'm not an expert, but when you look at nutrition labels, it will tell you how much trans fat and saturated fat is in a food. Try to avoid any food with those. Those are the truly bad fats for your heart and therefore your kidneys. And then limit sugar. If you're a diabetic, you know this. You've got to limit sugar. It's interesting. I grew up as a diabetic at age 6, and once I got my pancreas transplant, everyone thought I would just be craving sugar because I could finally eat it. But the truth is, after years of not really eating a lot of sugar, I don't crave it. But easy for me to say, right? For those of you who are sugar fiends, I know it's hard to cut back. So, take a look at some of these suggestions here. And by the way, there's a lot of hidden sugars as well. So again, your wonderful nutritional label will tell you that on each and every item you get. They even have to list that at the grocery store. They have to tell you how much sugar and everything else is in everything at the store. And same with restaurants now, I've noticed. As far as fruit juices that say they're unsweetened, or smoothies or things like that, remember that they're a very concentrated fruit juice, therefore there is a lot more sugar in it. And for snacks, think about apple slices, just at least once in a while rather than the chocolate cake. Oh, and the drinks, by the way, the frappuccinos, the iced teas. You can ask for sweetener. If you don't like sweetener, I understand, but try to cut back on how many you get. Baby steps. And then as far as portion control, I laugh about these too because I'm the worst. I eat like a bird most of the day, and then at dinner I have this big, huge plate of food. So I'm not any better at some of these ideas, but I'm trying. I'm going to try. So with portion sizes, I think the best idea here is to not eat out of bags or boxes. I think that was one of the funniest tips I'd ever seen, and yet so true. Don't eat out of the potato chip bag. Don't eat out of the box of fried chicken or donuts, which, by the way, is very hard to do for me too. And also, as far as little hints of how big something is, you can measure it, of course, ask Google. But if you just stick your palm out like that, I don't know if you can see my hand very well, inside your palm is about a 4-ounce size. So if you're looking at an 8-ounce steak or something like that, cut it in half. Have the second part tomorrow, give the second part to your partner, but that would be 4 ounces if that's what is on your diet, is a 4-ounce, a bit of meat. So the tip of your thumb, I can't tell if I can, yeah, from here up is considered like a tablespoon, and from here up, a teaspoon. It's just kind of cool, because if you think this up is a teaspoon and that's how much salt is recommended per day, that's not a lot of salt. And then eat foods high in nutrition. So again, fruits, veggies, whole grains, and lean meats. Now, I'm so sorry, I tried to make this bigger, but it's still very small. So I hope you can see this plate. I can barely see it, but there's some healthy oils to the left and water to the right. Drink lots of water, always good for you. If you hate water, try to just incorporate a little bit more water in your diet every day. It's just good for you. All right, so you see that the green is all veggies and then fruit down below, and then you've got the whole grains and the protein. How many of you have a plate like that? I don't. I'm guilty. I've learned so much just studying to give this presentation that my vegetable consumption is almost zero because I don't like them. But I am eating green salads now almost every day. Every day I do. Fruits I'm still terrible with. I tend to be a high protein eater for no particular reason other than I like it. And I'm trying to eat more beans and legumes and whole grains. So, like I said, just little tiny things you can add or take away just to start the habit of a different way of eating. Other lifestyle changes. Needless to say, smoking is a bad thing, and I don't know a smoker who doesn't know that. And if you're one of those whose whole family smoked and they lived to be 100, that's great, but that's not most of us. And so as a nurse, most of the people who came in through my door to come and get a transplant who had smoked all their lives had such bad hearts they didn't even qualify to get on the list for a transplant. Their hearts were so bad and they didn't seem to know it. So don't be ignorant about your heart. Stop smoking if you can. Start cutting down. Do something to make your heart better. Because if your heart's healthy, your kidney's healthier. Limit your alcohol and always, always work with your healthcare provider, whether it's your Minute Clinic or it's your doctor. Talk to them. Say, you know what? I know I need to make some changes. How can you help me? Most of them have a lot of great resources, so don't be afraid to talk to your doctors. In terms of ideas for diets and things like that, or learning more about kidney disease, you can always go to kidneyfund.org. They have lots of great information. They have a whole section called Kidney Kitchen if you are on a diet restriction because of kidney disease. It's a great resource for all kinds of information. So what do we do when we test for kidney health? It's really very simple. It's like a blood test and a urine test, and that's it. That's all it takes, and pretty easy to do. So that should come with your annual checkup. I know we've all been avoiding going to the doctors or doing virtual visits this past year, but do make one trip to the doctors and get some labs done, okay? Because it's the only way really we can figure out what's going on with your kidneys and other things for that matter. The urine test, there's actually two, but the one they're talking about here is a simple dipstick test that they do at the doctors. That test can show protein and blood and sugar. So if you're spilling protein in your urine test on a dipstick, chances are there's something going wrong with the kidney, but it may just be an inflammation. We don't know. But it gives the doctor reason to look into it a little further. The blood test does something where we can figure out your estimated glomerular filtration rate. I got it right, kind of. eGFR, I just tend to say GFR. A true GFR test is when you collect a urine sample for 24 hours in a big jug, and then they combine certain fats, like an equation where they take into consideration your race, your sex, your weight, and then they do a calculation of your kidney function, sort of like a score between 0 and 100. If you're doing the urine jug for 24 hours, and we do that on patients we already know have some issues, that may go up as high as over 100, like for kidney donors. But for most of us, it's just going to be the dipstick and the blood test. And the GFR will give you an idea of where you are in your kidney function. So here are the stages of chronic kidney disease, CKD, with your GFR, all these initials. So stage 1 is kidney damage. It's mild. It's a score of 90 or above. Frankly, 90 or above is a good score, especially if you're older. That's a great score. And as a transplant person, we did take living kidney donors who had a score of 90 or above. They had to have at least 90 or above to donate one of their kidneys. So that's not necessarily a bad thing, and you can do a lot with that to prevent it getting worse. But that is the other issue. If you have a score of 90, that could be normal, you're normal, but it also could be an early sign of kidney disease. Stage 2 is between 60 and 89, which is a pretty wide margin. Again, most people have no symptoms between 60 and 89. I actually think mine is there somewhere because I'm a transplant patient. But anyway, most people at stage 2, they have some damage. Remember that I said once your kidney is damaged, it cannot be reversed. So stage 3 is a GFR of 30 to 59. Again, a wide margin. Most people on that upper end are not going to have symptoms. Many people don't have symptoms in this stage either, but some might. On stage 4, between 15 and 29, there are people who still don't have symptoms. Or if they do, they're not tying it in with anything serious. So if you're someone who works a lot and is always tired, you may not realize that this is an early sign of kidney disease. And this isn't even early. This is a problem with kidney disease, with things like certain cancers, where you don't know, diabetes actually, where it can be in your system a long time and you don't know. You don't have any symptoms until it's kind of too late. Because once you hit stage 4, there's very little you can do to go into kidney failure. Maybe it'll last a long time at that stage and you can stay healthy for as long as you can. That's what we're here to talk to you about. But do know that stage 4, at that point, I'm hoping you get a symptom to tell you to go see a doctor. Stage 5 is kidney failure, or you're very, very close to kidney failure. That's where it's 15 or less. Just a brief thing I meant to mention. When your GFR is 20, in the United States, the United Network for Organ Sharing says that that's when you are technically listable for a kidney transplant, because at 20 they know your kidneys aren't going to get any better at that point. So I thought I'd just throw that in. Doesn't mean you qualify, it just means you are listable if you do qualify. So at stage 5, you're in kidney failure and you either need dialysis or transplant. So offensive plays are things you can do once you are diagnosed with kidney disease or kidney failure to kind of maximize your health as much as you can. So in managing chronic kidney disease, and again, I know this is a busy slide, I apologize. Preventing CKD from becoming kidney failure, a few things have to fall into place. One is it needs to be diagnosed really early. It needs to, this is where you have to control your blood sugars and you have to control your blood pressure, and you need to start with a healthy diet and stay active and all those things we talked about before. But the key there, because most people who get the kidney disease are diabetics or high blood pressure, is to watch both very closely. And with all of the new medications out there for type 2 diabetes, which is the majority of people who end up on dialysis, oh my gosh, they have pills for type 2 diabetes now. They're only once a week. And they are there to lower your average blood sugar or hemoglobin A1C. And testing your blood sugar is now easier than ever. I mean, they even have bloodless blood testing. I mean, testing for your sugars now. So really, it's not a good time. Never is a good time to be sick, but this is the time where you can take better control of those things thanks to new modern medicine, medications, and new testing. So with kidney failure, remember that, once the kidneys are diseased, they are not going to get better, okay? They will, I should say most of the time. With chronic kidney disease, with any damage to your kidney, it cannot be reversed, and that is true. Now, some of you may say, well, my friend was in the hospital and ended up dialysis, but afterwards they were fine. That's a different thing called acute kidney failure. That's a totally different thing, and yes, they can recover from that. Chronic kidney disease, though, is much more prevalent in this country, and that's where, unfortunately, you can't undo the damage, okay? Did I change it? There we go. So what are the symptoms of kidney failure? I've been talking about all this time. There's lots, and some people have none of these, and some people have all of these. I can say from my experience, the most common ones were tiredness, fatigue, metallic-like taste in the mouth. Oh, I remember that so well. How many of you who have been through kidney problems know that taste? Swelling of mostly the legs, ankles. I was one of those who swelled up a lot, so it was not a big secret that something was going on with me. Some people become confused. They become like they're throwing up all the time, loss of appetite. Those people, remember that the kidney isn't eliminating all the waste products, so it's building up in your blood, and that's what causes that toxin stuff. And then others are short of breath, and shortness of breath is a pretty common one. It's also a pretty scary one, and believe it or not, there are people who go into the ER in stage 5, and what brings them in is they're finally so sick they can barely catch their breath. They have no idea they have kidney failure. And that is a huge majority of people who come into the transplant center, is that they ended up in the ER and then found out they had kidney disease and didn't even know why. So, treatment methods. So obviously, there are ways to treat kidney failure. They're not cures, but they are treatments. There's hemodialysis, peritoneal dialysis, transplant, and then there's supportive care. So we'll go through each one. So with hemodialysis, you see I hope my picture's not in the way. I don't think so. You see the drawing on the right? Basically, you have what's called a fistula or a graft or something put into with your veins in your arm, and a needle is inserted. You go into a center, or you can do this at home, and a machine takes a little bit of your blood out at a time, cleans it, and puts it back into you. When they clean it, they're making sure the potassium is right, they're taking out all that extra fluid, and they're taking out the toxins. And then that is done generally about 4 hours each time, 3 days a week, but some people go 4 days a week. I was a 3.5 hour, 3 days a week. It's very hard on the body, but it's what you do to survive. And then home hemo, I think, is the best thing that's happened in a long time. I want to say it's been around about 15 years. It's really common now. You need a care partner at home, but you do this setup at home. You learn to stick yourself, or your partner learns to stick you, and you do your dialysis 2 to 3 hours, 5 or 6 days a week. And studies have shown, I saw this actually as a nurse, and I was just amazed at how different those patients looked versus the ones in center on a machine, where they go somewhere. And that is, it cleans your blood all the time, much more often. Europe does this, by the way, every day. They dialyze. And they look much better, and they say that they do almost as well as transplant recipients. So if transplant is not an option for some patients, home hemo has been a great alternative. And many of these people can continue to work because they're not tied down to 3 days of going and then being so tired they can't work the rest of the day. So that's dialysis. Peritoneal dialysis is completely different. This is what I had the first time I was on dialysis. And a tube is inserted into your belly. this picture on the left, okay, this is not a man with a baby, but it looks like it. This is the abdominal cavity is what they're showing. When they put the tube in, it stays in the whole time you're on dialysis, whether it's a year or several years. And you hook up to a tube that's a two-way system. So you drain out the fluid that's been in there, and it goes out into a bag, or you can just put it straight into your toilet at home. And then you put in the new bag of what's called dialysate. It's a special fluid that goes into your belly, and it dwells in there for a few hours. And then you do the whole process again. You empty out the old, and guess what the old fluid looks like when it's coming out? Any guesses? It looks like urine. Yeah, it looks like urine. It does exactly what the blood one does, except it's drawing the fluid and the waste into the belly, and then the belly drains it out. It's really pretty awesome. And what's nice is if you're really good with your self-care and you don't mind doing all of this and using the machine, you can also use this just at night only, which is what I did. So I could continue to do what I wanted during the day. So people who do this are a lot more independent. They want to be able to control what's going on, and they'd like to be able to hold down a job or do what they need to do with their families. So it's a good option too. So kidney transplant, overall, again, studies will show you that people who get a kidney transplant usually have a better quality of life and live longer than those on dialysis. Now, kidney transplant is not for everybody, however. So a kidney transplant, obviously you can get a kidney put into your body via an operation from either a living donor or a deceased donor. That matches, and the only downside to me for transplant is the surgery. It's a big surgery, but also you got to take anti-rejection medicines for the rest of your life, or at least the rest of the life of the organ. So, and that's not, well, when I feel like it, well, just for a year. No, you got to take them every day, sometimes twice a day, usually twice a day, for the rest of your life. And that takes a huge commitment. And other medications have to be taken as well. You still have to live a healthy lifestyle. And if you don't take the medicines, you will reject the kidney and lose it. Supportive care is an option. Most people who choose this option are older, or they've been on dialysis a very long time and just are tired of it. And they don't want transplant, or they're not eligible. So these folks decide to just go on supportive care, which means referral to a hospice. And yes, they will pass away without any treatment. Okay, well, that was a downer on the inside, but some people do choose that option. On recap, the important things to know is that once the kidneys are damaged, it's permanent. Once the most common causes of kidney failure are high blood pressure and diabetes, or both. And the best ways to prevent kidney disease is obviously keeping healthy, and that really means, especially if you know you're diabetic or you have high blood pressure, to check your blood sugars and take the blood pressure medicines. If you, by the way, don't like your blood pressure medicines, or they have side effects you don't like, gentlemen, then go talk to your doctor about trying different medications. There's tons of them out there. Don't think you're stuck with one. Always check in with your healthcare providers. All right, and then eating healthy, staying active, and early screening. I think that's, to me, the biggest key. You can go into any pharmacy or grocery store and sit in a chair and get your blood pressure checked. And if you've ever noticed, it's always your left arm they want to check because it's closer to the heart, and that's where they can detect blood pressure, high blood pressure early on. So check that. If it looks a little high, check it 2 more times. If it's still high, you should check in with your healthcare provider. You probably have hypertension. Okay, and then screening for blood sugars. You know, if you ever see a health fair where they do that, get it done. Or just get your annual checkup with your doctor or healthcare provider and have them run a set of labs on you. It's probably the easiest way to prevent any of this from happening. I hope this helped. If you have questions,